Listen to me. I want you to close your eyes for just 1 second and think about your retirement. You worked 30, 40, 50 years for this moment. You saved, you sacrificed, you did everything you were supposed to do. But instead of feeling completely free, there is a quiet, heavy fear sitting in the pit of your stomach. And that fear has a name: healthcare. You are terrified that one bad diagnosis, one unexpected slip on the ice, or one chronic illness is going to step in and absolutely wipe out every single penny of your hard-earned life savings. You are not alone in this fear. Every single day, I hear from people just like you who are about to turn 65, and they are drowning in confusion. The mailbox is overflowing with glossy brochures, the phone is ringing off the hook with salespeople trying to sell you different plans, and you are left asking one fundamental, urgent question: what is Medicare, and how do I use it to protect my money and my life? Today, we are cutting through the noise. No confusing jargon, no sales pitches, and absolutely no fluff. Just the raw, honest truth about how Medicare works, because making a mistake here is not just a headache, it is a financial disaster that can penalize you for the rest of your living days. Let's start with the absolute basics. Medicare is our federal health insurance program primarily for people aged 65 and older. But here is where everyone gets tripped up. They think Medicare is just one single, simple plan. It is not. It is an alphabet soup of different parts, and if you do not understand how they fit together, you are going to leave yourself wide open to massive financial risk. First, you have Original Medicare, which is run directly by the federal government. This is made up of Part A and Part B. Think of Part A as your hospital insurance. If you get admitted to a hospital room, need skilled nursing care, or require hospice, Part A is what kicks in. Now, here is the good news: for about 99% of you, Part A is going to be completely premium-free. Why? Because you already paid for it. Every single time you looked at your paycheck and saw those FICA taxes being taken out year after year, you were buying your future Part A coverage. If you or your spouse worked and paid those taxes for at least 10 years, your monthly premium is $0. But do not let that fool you into thinking Part A is totally free. It has a deductible. In 2026, if you are admitted to the hospital, you have to pay a deductible of $1,736 out of your own pocket before Medicare pays a single dime. Once you meet that deductible, Medicare pays 80% of your medical bills, and you are responsible for the remaining 20%. I want you to stop and think about that 20%. 80% sounds great, doesn't it? But that remaining 20% has absolutely no cap. No limit. If you have a major surgery that costs $100,000, your share is $20,000. If you do not have secondary insurance to cover that gap, you are on the hook for unlimited out-of-pocket costs. That is a massive financial vulnerability, and we are going to fix it, but before we do, we have to talk about your prescriptions, which brings us to Part D. This is your drug coverage, run by private insurance companies approved by Medicare. In 2026, thanks to the Inflation Reduction Act, there is an incredibly important safety net you need to know about. Your out-of-pocket drug costs are strictly capped at $2,100 for the entire year. Once you hit that $2,100 limit on covered medications, you pay $0 for your drugs for the rest of the calendar year. This is a massive win for your wallet, especially if you take expensive brand-name medications. So, how do we protect ourselves from that unlimited 20% coinsurance in Part B? You have two completely different paths to choose from, and this is the single most important financial decision you will make in retirement. Path number 1 is staying with Original Medicare, Parts A and B, and adding a private Medicare supplement insurance policy, also known as Medigap. Medigap plans do exactly what they sound like: they bridge the gap. They step in and pay that 20% coinsurance, your deductibles, and other out-of-pocket expenses. If you choose this path, you pay your Part B premium, your Part D drug premium, and a monthly Medigap premium. Yes, it is more expensive up front. You are restricted to a network of doctors. If you see an out-of-network specialist, you could be forced to pay the entire bill yourself. Furthermore, many services require prior authorization, meaning the insurance company can step in and deny a procedure your doctor says you desperately need. While these plans have a maximum out-of-pocket limit, you have to pay copays every single time you see a doctor or get a test until you hit that limit. If you stay healthy, a Medicare Advantage plan can save you money. But if you get sick, those copays add up fast, and you might find yourself wishing you had the freedom of original Medicare with a Medigap plan. So, what is your actionable takeaway today? How do you protect your peace of mind and your wallet? First, write down your retirement date and your 65th birthday. Your initial enrollment period is a strict 7-month window. It starts 3 months before the month you turn 65, includes your birthday month, and ends 3 months after. If you miss this window and you do not have qualifying health coverage from an active employer, you will face a 10% lifetime late enrollment penalty on your Part B premiums for every 12-month period you went without it. That penalty stays with you forever. Do not let procrastination cost you thousands of dollars over your lifetime. Second, sit down and assess your personal health and financial situation. If you value absolute freedom, the ability to see any specialist in the country without a referral, and you want 100% predictable medical costs, choose Original Medicare with a Medigap policy and a Part D drug plan. If you are on a very tight monthly budget, are comfortable staying within a local network of doctors, and are willing to deal with pre-authorizations, then look into Medicare Advantage. But do not make this decision based on a television commercial. This is your money. This is your life. You have worked far too hard to let confusion or a lack of planning ruin the retirement you deserve. Take control of your healthcare decisions today. Be strong, be smart, and stay secure.